Hi everyone, I'm back again with a video in my study series, and today we're going to speak about fluoroquinolones. Fluoroquinolones are the class of antibiotics that we're going to speak about today. So let's get going with it. So fluoroquinolones inhibit bacterial DNA and they're considered to be bactericidal. They kill bacteria. And they treat a broad range of infections. Some of the examples that they treat are urinary tract infections, respiratory infections. They also treat anthrax if their client had anthrax exposure, and gonorrhea. So how can we identify a fluoroquinolone? So examples of fluoroquinolones are ciprofloxacin, levofloxacin, and moxifloxacin. And if you would notice, they all end in floxacin. So that's a way for you to identify a fluoroquinolone. Fluoroquinolones can be given by the intravenous route, and they also can be given orally. When you have a client that's getting let's say for example, IV moxifloxacin or any one of the fluoroquinolones, we're going to monitor the IV site. We're looking for redness, we're looking for swelling. We want to make sure that the site is patent, intact, and is functioning well. We also want to slowly infuse fluoroquinolones. We don't want to give them rapidly. So we want to try to infuse them over a period of at least 60 minutes. Fluoroquinolone have some side effects that I need to go over with you. So there are central nervous system disturbances. Yes, fluoroquinolones causes drowsiness, dizziness, blurred vision. It also causes headaches. So those are just of the central nervous system disturbances that it causes, but there are others as well. Photosensitivity. There is a phenomena of QT prolongation, peripheral neuropathy, and there is also a risk of Achilles tendon rupture. So we're going to go over these side effects, but before we do that, if you're getting value from this study session, hit the like button, subscribe, and hit the notification bell. And if there is a topic that you would like me to cover on this channel, please leave it in the comments. Leave a comment on what topic you want me to study with you next. So moving on. Photosensitivity. For our clients, we want to teach our clients to avoid sun exposure. However, maybe there's a time that your client would have to go outside. Maybe they need to go back to a doctor for an appointment. So what we're going to do, we're going to teach our client when they go outside, they need to wear protective clothing. They need to cover their arms and their legs. They should wear a wide brim sun hat to protect their face and their neck from sun exposure. They can use sunglasses. They can actually use an umbrella to shade them from the sun. And of course, they will use sunscreen. However, if your client is allergic to sunscreen, we're going to tell them to discuss with the healthcare provider about their sun protection. Okay? QT prolongation. So first to begin with, we do not want to give a fluoroquinolone to a client that already has a history of QT prolongation. We also don't want to give it to someone that has other cardiac arrhythmias because there is an increased risk, especially when it's being given with certain antiarrhythmic agents. So we have to be very careful with that. Even though it's rare, the QT prolongation can lead to tossage de pointe, and it can lead to other ventricular arrhythmias, and it can also lead to cardiac arrest and death. So we need to monitor our clients' ECG because this QT prolongation can actually be lethal. It can be fatal for our client because it can lead to death, right? So we must monitor our clients' ECGs. There are some people who should not get fluoroquinolones, and we want to avoid it in pregnant clients. We want to avoid it in clients who are breastfeeding, and we also want to avoid fluoroquinolones with children under the age of 18 because there is a possibility again of this Achilles tendon rupture, so it can affect the tendon and the cartilage in developing children. So for that reason, we don't want to give it to children. And we also don't want to give it to someone that has myasthenia gravis because it can cause an exacerbation of the symptoms if it's given to someone that has myasthenia gravis. So some other considerations for fluoroquinolones, one of the things that we need to question our clients about before we give them this medication, we want to know if they have any history of head trauma or seizures, or do they take any medications that has seizure as a side effect, because one of the side effects of fluoroquinolones is central nervous system disturbances. So we don't want to and we have to be very careful if we're going to give this medication to someone that already has an issue that involves their central nervous system. We're going to monitor kidney and liver function of our clients while they're taking fluoroquinolones, because fluoroquinolones are excreted in the urine. So we want to monitor our clients' kidneys, and we also want to monitor their liver function, and particularly in elderly people, because they have increased side effects from medications on a whole. So this is something that we need to do to keep our clients safe. Other things that we need to do, we need to advise our clients that milk products and antacids will inactivate the medication. So all of these things that are listed here, we want to make sure that we do not give them within 4 hours before or 2 hours after taking these medications. Fluoroquinolones interacts with warfarin. It increases the effect of warfarin, and with theophylline, it increases the serum theophylline level. Because fluoroquinolones cause CNS disturbances, we want to take safety precautions with our clients. So we want to assist our client because we want to prevent falls, because your client may get dizzy, because that is one of the side effects. So we want to take safety precautions with our clients. We want to keep the call bell within reach of our clients, so they will call if they need assistance. We're going to assess for signs and symptoms of peripheral neuropathy. And how would we assess for that? So our client may complain of burning or a tingling sensation. They may complain that it's numb, or they may complain about some kind of alteration in sensation. So maybe if you lightly touch the extremity they're complaining about, you might not the client might tell you that they don't feel it. So we want to assess our clients for symptoms of peripheral neuropathy, because that is a side effect of fluoroquinolones. And again, we want to monitor our clients' IV site if they're getting their medication by the IV route. Some client teaching, we want to take them to take the medication at the prescribed time intervals, because we want to keep a therapeutic level of the medication in our client, so that it can effectively fight the bacteria that's making them sick. We want to tell our client to finish the medication completely, even if they're feeling better, because if they stop taking the medication prematurely, the infection may actually get worse and it may get resistant to the current regimen. We want to teach the client to contact the healthcare provider immediately if they experience any kind of tendon pain, inflammation, or swelling, because they're actually going to need to stop taking this medication. But we need them to contact the healthcare provider so that way the provider can provide further instructions and evaluation in terms of what it wants the client to do. We want to teach our client to take it on an empty stomach, and we need to take it 1 hour before or 2 to 3 hours after a meal, and we should take it with a full glass of water. Now, they can take it with any liquid, but remember I told you that calcium and milk products will cause the medication to be inactivated. So remember, we have to teach our client also to be careful with orange juice, because remember, we also have calcium fortified orange juice. So that's something that we'll have to teach our client that they cannot take this medication with. We want to advise our client to use sunscreen and protective clothing to prevent photosensitivity reactions. We want to teach our client to use caution, and they should actually know how they react to this medication before they start driving or operating any kind of machinery or doing any activity that require mental alertness, because remember, headache, dizziness, blurred visions are all side effects of this medication. Fluoroquinolone also has this strange phenomenon where it causes false positive urine drug screen. And we need to teach our client to not treat fever with diarrhea or diarrhea with fever at home. They need to contact the healthcare professional, because that may possibly be C. diff diarrhea, and we don't want our clients treating that themselves at home. So thank you for studying with me again. That's all the notes that I have for you today. If you did like what I presented to you for today and you got value from it, like the video, subscribe, and hit the notification bell so that you don't miss another study session from me. It was my pleasure studying with you again today. So take care, be well, and until the next video, bye-bye.